Hello and welcome to eMedicore, Patient's Corner series. Today's discussion is on ureteroscopy. Ureteroscopy is a procedure in which a small telescope, called a ureteroscope, is inserted through the urethra, through the bladder, and up into the ureter. It is used to diagnose and treat a variety of problems in the urinary tract, such as ureteral or kidney stones. If the stone is small, it can be removed using a device called a stone basket. If the stone is large, it can be broken down into smaller pieces using a laser, a procedure known as laser lithotripsy. Ureteroscopy is usually performed under general anesthesia. It is usually done as an outpatient procedure, going home the same day. However, some patients may require an overnight hospital stay if the procedure proves difficult or lengthy. Here we have two diagrams showing the female and male urinary tract. Here we see two clips, one showing a small stone removal using a stone basket, while the other clip shows a large stone removal using a laser lithotripsy procedure. Warning: these video clips include footage from an actual procedure which some viewers may find difficult to watch. There are risks and complications associated to intravenous sedation or general anesthesia. In addition, there are potential specific risks related to ureteroscopy. These risks may include bleeding or hematuria, which is the presence of blood in the urine, and this is common. Pain or burning during urination, which is common. Infection, which is rare. And sepsis, which is bacteria spreading into the bloodstream. This is rare. Injury to the ureter or kidney, this is rare. And urinary retention, or the inability to urinate, is rare. Additional procedures or surgeries that may be needed are also rare. Before the procedure, your doctor will perform a history and physical exam, as well as order appropriate laboratory tests to make sure you are in good condition for the procedure. You should let your doctor know if you are or may be pregnant, have any allergies to medications or food, such as seafood, or allergies to latex, such as rubber. You should let your doctor know of all the medications you are taking, including over-the-counter medications. If you are taking blood thinners, such as Coumadin, Plavix, aspirin, ibuprofen, etc. Ask your doctor when to stop taking these medications. If you have diabetes, you should ask your doctor if you should stop taking diabetic medications on the day of procedure. Normally, you can take other medications with a tiny sip of water. Generally, you cannot eat or drink anything with the exception of a tiny sip of water at least 8 hours prior to the procedure. You should also arrange for transportation to and from the surgery center or hospital. Sometimes your doctor may need to insert a ureteral stent after the ureteroscopy. A ureteral stent is a small, soft, flexible plastic tube that goes from the kidney to the ureter to the bladder. The stent has a coil that is J-shaped in the kidney and another J-shaped coil in the bladder. Sometimes the stent will be called a double J stent. The stent helps ensure the drainage of urine from the kidney into the bladder without obstruction from the swelling of the ureter after a ureteroscopy. It is very important that the stent needs to be removed as instructed by your doctor. Having the ureteral stent inside your body for too long may cause stone formation, blockage of the ureter, or loss of kidney function. Your doctor may give you pain medication or antibiotics to take after ureteroscopy. You may expect some burning or discomfort during and after urination. You should also expect mild or moderate pain in your side or back during and or after urination. It is common to see blood in the urine, pink-colored blood. You are encouraged to drink more water and urinate often. If you have a ureteral stent placed, you may feel the urge to urinate often and have pain in the bladder. Try to relax during urination. Do not push or strain, as pressure will build up in the bladder and be transmitted up the stent to the kidney, causing more pain in the kidney. You should call your doctor if you have a fever of a temperature greater than 101 degrees Fahrenheit, shaking chills, heavy bleeding, which is passing blood thick like ketchup, severe pain that is not controlled by pain medications, severe nausea, and vomiting. The above information is not intended to replace the advice of a physician. It is an educational aid only. eMedicor disclaims any liability for the decisions you make based on this information.
eMedicor, core medical education. For everyone.
From everywhere.
Forever free.